1. Introduction to hantavirus and global monitoring. Hantaviruses are a group of viruses primarily carried by rodents. Humans can become infected when they inhale microscopic particles from contaminated rodent urine, droppings, or saliva. Although these infections are relatively rare compared with many other diseases, they are medically significant because they can lead to severe illness. Different hantaviruses are associated with different syndromes. In the Americas, the most recognized form is Hantavirus Pulmonary Syndrome, often abbreviated as HPS. This condition can begin with symptoms that resemble the flu, including fever, muscle aches, and fatigue, but it can progress rapidly and affect the lungs, sometimes causing life-threatening respiratory failure. In Europe and Asia, hantaviruses more commonly cause hemorrhagic fever with renal syndrome, or HFRS. This form typically affects the kidneys and may range from mild to severe depending on the viral strain involved. One of the most important aspects of hantavirus surveillance is understanding where reservoir species live. Each virus tends to be associated with specific rodent hosts, and human infections often reflect environmental and ecological patterns rather than sustained human-to-human transmission. This makes geographic monitoring especially useful. Maps and dashboards can help reveal where cases have been reported, where rodent populations are known to carry the virus, and where environmental conditions may increase the likelihood of exposure. Most infections occur in situations where people come into contact with enclosed spaces contaminated by rodents, such as sheds, barns, cabins, storage areas, or rural dwellings that have not been cleaned for some time. Seasonality can also play a role. Human cases may rise when weather patterns increase rodent populations, when food availability changes, or when people engage in activities such as farming, camping, or cleaning buildings after long periods of closure. Because hantavirus disease is uncommon, even a small number of cases attracts attention from epidemiologists and public health agencies. Each confirmed case can provide valuable insight into transmission patterns and environmental risk factors. Data visualization tools are especially helpful for identifying trends over time. They allow viewers to compare regions, observe historical clusters, and understand how surveillance differs from one country to another. It is also important to recognize that reported cases do not necessarily reflect all infections. Some mild cases may go undiagnosed, while differences in testing capacity and reporting practices can affect the completeness of available data. For that reason, these dashboards should be viewed as analytical tools rather than exact real-time counts of every infection worldwide. When interpreted carefully, they offer a useful first look at the broader picture, where hantavirus activity has been documented, how patterns vary by region, and what environmental factors may be contributing to risk. Throughout this video, the goal is to examine multiple sources side by side, compare the information they present, and gain a more informed understanding of how hantavirus surveillance is visualized across the web. 2. Hantavirus Pulmonary Syndrome. Clinical perspective. Hantavirus pulmonary syndrome is one of the most serious rodent-borne diseases identified in the Americas. The illness typically begins after an incubation period that can range from 1 to several weeks following exposure. Early symptoms are nonspecific and may include fever, chills, headaches, muscle pain, nausea, and abdominal discomfort. Because these symptoms resemble many other infections, early diagnosis can be difficult. The most dangerous phase begins when fluid starts accumulating in the lungs. At this point, patients may experience shortness of breath, coughing, and rapidly worsening respiratory distress. Hospitalization is usually required, and intensive care support may be necessary. There is no specific antiviral treatment that has been proven universally effective for HPS. Management focuses on supportive care, including oxygen therapy and mechanical ventilation when needed. Early recognition and prompt medical attention significantly improve the chances of survival. The case fatality rate can be substantial, which is why even isolated infections are taken very seriously by public health authorities. In North America, the sin nombre virus is the most well-known hantavirus associated with HPS. It is carried primarily by the deer mouse, a common rodent found in many rural and semi-rural areas. Human infection does not require direct contact with rodents. Simply disturbing contaminated dust can be enough to aerosolize viral particles. This is why prevention guidance emphasizes ventilation, protective equipment, and careful cleaning procedures. The rarity of HPS sometimes leads to low public awareness, but the severity of illness makes education essential. Maps and surveillance tools help place individual cases into context, showing that although uncommon, infections are geographically and ecologically predictable. Understanding the clinical impact of HPS adds important perspective when analyzing the data presented across different dashboards. 3. Global ecology and rodent reservoirs. The ecology of hantaviruses is one of the most fascinating aspects of their epidemiology. Unlike many infectious diseases that spread primarily from person to person, hantaviruses are maintained in nature through long-term relationships between specific viruses and their rodent hosts. Each viral strain is usually associated with one or a few closely related species. For example, the deer mouse is linked to sin nombre virus in North America. In South America, several rodent species are associated with Andes virus and related strains. In Europe, the bank vole is an important reservoir for Puamala virus. These host-virus relationships are remarkably stable over time. Rodents typically carry the virus without becoming severely ill. They shed viral particles in urine, feces, and saliva, creating opportunities for human exposure. Environmental conditions strongly influence rodent populations. Rainfall, temperature, food availability, and habitat changes can all affect how many animals are present in a region. When rodent numbers increase, the probability of human contact may also rise. A classic example occurred in the southwestern United States during the early 1990s, when unusually wet conditions led to increased food resources and larger rodent populations. This ecological shift was associated with a notable rise in human cases. Land use patterns also matter. Agricultural expansion, deforestation, urban encroachment, and changes in housing conditions can alter contact between people and wildlife. In some settings, occupational activities such as farming, forestry, military training, and field research can increase exposure risk. Outdoor recreation may also contribute when individuals sleep in rodent-infested structures or disturb contaminated materials. Different regions show distinct epidemiological profiles. In Europe, many infections are associated with milder forms of disease, while parts of Asia report much larger numbers of HFRS cases. In the Americas, total case counts are lower, but pulmonary syndrome tends to be more severe. Another important consideration is underreporting. In areas with limited diagnostic capacity, infections may be missed or misclassified. As a result, observed patterns reflect both true ecological differences and variations in surveillance systems. This is why comparing multiple data sources is so valuable. When independent dashboards highlight similar hotspots or recurring geographic clusters, confidence in the underlying pattern increases. Long-term data can also reveal periodic cycles. Some rodent populations fluctuate over several years, leading to corresponding changes in human case counts. Researchers study these cycles to better anticipate periods of elevated risk. Climate change is another active area of investigation. Shifts in temperature and precipitation may influence habitats, food availability, and species distribution, potentially affecting the geographic range of certain rodent hosts. However, these relationships are complex and vary from region to region. The ecological perspective reminds us that hantavirus surveillance is not just about counting cases. It is about understanding the interaction between viruses, animals, environments, and human behavior. When viewed through this lens, maps become more than visual displays. They become tools for interpreting the dynamic relationship between ecology and public health. 4. Symptoms and diagnostic challenges. One of the main challenges with hantavirus infections is that the early symptoms are nonspecific. Patients often experience fever, fatigue, muscle aches, and headaches. Some may also develop nausea, vomiting, or abdominal pain. These symptoms overlap with many other viral illnesses. As a result, Hantavirus infection may not be immediately suspected unless there is a clear history of rodent exposure or residence in an endemic area. Laboratory testing is essential for confirmation. Diagnosis commonly relies on serology to detect antibodies, molecular methods such as PCR, and clinical correlation. Healthcare providers also consider blood abnormalities, including low platelet counts and evidence of hemoconcentration. Imaging studies may reveal rapidly developing pulmonary edema in severe cases. Because disease progression can be abrupt, clinicians emphasize early recognition and close monitoring. Public health reporting and case investigation then contribute to the datasets displayed in surveillance dashboards. Every point on a map represents not only a statistic, but a clinically significant event that required diagnostic evaluation and formal confirmation. 5. Prevention and exposure reduction. Preventing hantavirus infection centers on minimizing contact with rodents and their excreta. The most important principle is to avoid stirring up contaminated dust. Before cleaning enclosed spaces such as sheds, garages, cabins, or storage rooms, the area should be ventilated thoroughly. Contaminated surfaces should be disinfected rather than swept or vacuumed dry. Using gloves and, in higher risk situations, respiratory protection can further reduce exposure. Food should be stored in rodent-proof containers, and openings that allow rodents to enter buildings should be sealed. Trapping and habitat management are also key components of control. Individuals who work in agriculture, pest control, wildlife management, or field research may need additional precautions. Travelers and campers should be aware of rodent activity when choosing sleeping locations. Public health messaging focuses on practical steps because there is currently no widely used vaccine for most populations. The good news is that infection is largely preventable when environmental hygiene and rodent control measures are applied consistently. Surveillance data reinforce this message by showing where exposures have occurred and highlighting recurring ecological contexts associated with infection. 6. Why rare diseases still matter. Although hantavirus infections are uncommon, they remain highly relevant to public health. Rare diseases can have severe outcomes, and each case offers important insight into environmental conditions, diagnostic readiness, and prevention opportunities. Monitoring uncommon infections also helps strengthen surveillance systems. When health agencies can detect and investigate rare events effectively, they are better prepared to respond to more widespread threats. Hantavirus serves as a clear example of how even small datasets can provide meaningful information when analyzed carefully. 7. Comparing surveillance data sources. When reviewing multiple dashboards, it is common to notice differences in totals, locations, and update frequency. These variations do not necessarily indicate errors. They often reflect differences in methodology. Some platforms rely on official public health reports, while others aggregate information from news articles, research publications, or automated monitoring systems. Case definitions may also differ. One source may include only laboratory-confirmed human infections, while another may display suspected cases, historical outbreaks, or rodent surveillance findings. Geographic resolution is another factor. Some maps provide country-level data, while others show states, provinces, or specific coordinates. Time frames may vary as well. A dashboard emphasizing long-term historical context will look different from one focused on recent updates. By comparing multiple sources, viewers gain a broader perspective and can identify patterns that are consistent across independent datasets. This comparative approach improves interpretation and helps distinguish meaningful trends from isolated anomalies. 8. Public health significance and research value. Hantavirus surveillance contributes to both immediate public health action and long-term scientific research. Case investigations help authorities identify exposure settings, issue prevention guidance, and detect emerging patterns. At the same time, accumulated data allow researchers to study seasonality, environmental drivers, and host distribution. These insights support risk modeling and may help forecast areas of increased concern. Hantavirus research also advances understanding of zoonotic diseases more broadly. The principles involve wildlife reservoirs, environmental change, and spillover into humans apply to many other infectious threats. As a result, the lessons learned from hantavirus extend well beyond this specific disease. Maps and dashboards make these scientific and public health efforts more accessible by translating complex datasets into formats that are easier to interpret. For students, analysts, and curious viewers, they provide an efficient way to explore how epidemiological information is organized and communicated. 9. Interpreting data with caution. Data visualization is powerful, but interpretation requires context. A concentration of cases on a map does not always mean risk is increasing. It may reflect stronger surveillance, better diagnostics, or more complete reporting. Conversely, regions with few reported cases are not necessarily free of disease. Limited testing and underdiagnosis can mask true activity. Historical data should also be considered carefully. A large outbreak years ago may dominate the visual impression even if recent activity is minimal. Understanding what each dataset includes and what it excludes is essential. The most reliable conclusions come from comparing multiple sources and focusing on broad patterns rather than individual numbers alone. This analytical mindset is valuable not only for hantavirus, but for interpreting epidemiological data in general. 10. Hantavirus in a global One Health context. Hantavirus is an excellent example of the One Health concept, which recognizes that human health, animal health, and environmental conditions are deeply interconnected. The virus persists in rodent populations. Environmental factors shape host abundance, and human behaviors determine opportunities for exposure. No single discipline can fully explain these patterns. Epidemiology, ecology, climatology, veterinary science, and public health all contribute to a more complete understanding. One Health approaches encourage collaboration across these fields. For hantavirus, this may include wildlife surveillance, habitat analysis, laboratory diagnostics, and community education. The same framework is increasingly used to address many emerging infectious diseases. Monitoring rodent-borne viruses also highlights the importance of environmental stewardship. Changes in land use, biodiversity, and climate can alter disease dynamics in ways that are not immediately obvious. Studying these interactions helps researchers identify drivers of risk and develop more effective prevention strategies. Global dashboards play a useful role by bringing together information from different regions and making patterns easier to compare. They allow viewers to appreciate both the local details and the broader international context. Even when case numbers are small, the underlying lessons are significant. Hantavirus demonstrates how a pathogen can remain tightly linked to natural ecosystems while still posing serious consequences for human health. It also illustrates the value of integrated surveillance systems that combine environmental awareness with clinical and laboratory data. In this sense, hantavirus monitoring provides insights that extend far beyond a single disease. 11. Final observations and key takeaways. After reviewing multiple dashboards and data sources, several themes become clear. First, hantavirus remains a rare but important zoonotic disease with potentially severe outcomes. Second, geographic patterns are strongly influenced by rodent ecology and environmental conditions. Third, surveillance data are most meaningful when interpreted with an understanding of methodology, reporting differences, and clinical context. Comparing multiple sources provides a richer perspective than relying on a single dashboard. Consistent patterns across independent platforms can strengthen confidence in the broader conclusions. At the same time, differences between sources remind us to interpret data thoughtfully. The most effective prevention strategies remain practical and straightforward, reducing rodent exposure, maintaining clean environments, and recognizing symptoms early. For researchers and public health professionals, hantavirus continues to offer valuable lessons about zoonotic transmission, environmental health, and disease surveillance. For general audiences, these dashboards provide an accessible way to explore real-world epidemiology in action. They show how information is collected, organized, and visualized to support understanding and decision-making. Ultimately, the value of these tools lies not only in the numbers they display, but in the broader insights they provide about the relationship between humans, animals, and the environments we share. Thank you for following this in-depth overview. If you find this type of analytical and educational content useful, exploring multiple data sources side by side can be an excellent way to deepen your understanding of infectious disease surveillance and global health trends.